I'm Breanne, and I'm a group fitness instructor. I've been teaching for many years now, and I also am a real estate investor. I live a very active lifestyle. I've got 4 kids. I do not have the mental bandwidth to slow down. Actually, when I was pregnant with any one of my kids, my greatest fear is that a doctor was going to tell me I'd be on bed rest. The thought of slowing down and not being able to do the things that I want to do is horrifying to me. In January of 2024, about a year ago, I slipped on some ice in Texas somehow. And I just was walking up our driveway, there was some ice on it, and my feet just slipped right out from under me. I caught myself in like a plank position, but didn't have my core engaged, so my back snapped down. And apparently I herniated a disc in my back. And I did not realize that I had hurt myself so bad. I just thought I was going to be really stiff and sore for a few days, which I was like, I'll give it a few days to see how it goes. While I was really stiff and sore, it wasn't like unbearable, but I also kind of knew that something wasn't quite right. So after a couple weeks of it not getting better, I decided I would go see a physical therapist to see what was up. They identified some imbalances in some weak areas and things that they thought was wrong. And we even specifically talked about a potential disc herniation, and he didn't think that that was part of the issue. I was going through some physical therapy and was actually getting some really good results with that. And it was starting to feel a lot better, but also I wasn't modifying my workouts and giving my body the time to appropriately heal at the same time. So while I wasn't necessarily feeling as much pain, I also wasn't allowing it to heal, which I think caused a lot of inflammation. And one day I was at the gym and I saw Dr. Martin, who is a friend of mine, and he had actually talked to me earlier about my back, and he's like, I think you might have a herniation. I was like, no, I don't have a herniation. I'm seeing a physical therapist, I'm fine. It was definitely some denial, but this one day I saw you and I was in a lot of pain that day. And I was finally ready to listen. So you got me in to get a MRI right away. I think it was maybe even that same day, and in your office to start treatment like that day or the next day. It was really soon afterwards. And sure enough, I had a 7mm herniation in my disc. So the symptoms at the time was it presented more of a hip issue, which is a lot of reason why I didn't think it was a back issue at all. I didn't have any pain in my back. It was all in my hip. In my hip, which the side of the hip running down the side of my leg, and glute. Yeah, so buttock, hip, side of the leg, eventually down, all the way down to and under the side of my foot. Eventually, numbness, tingling on the foot, kind of some numbness feeling on the side of the leg. Most of the pain was in the hip and glute area. 0 back pain, like none. You put me on the stretching machine, which feels actually amazing. You kind of wonder like if it's gonna feel good or not, but when it pulls you apart, it takes all that pressure off of your spine and you feel amazing. So you start out light, just a little bit of stretch, and every additional treatment we would add a little bit more stretch, a little bit more pull on it. Yeah, I mean, it was like the weight of the world had been pulled off of my shoulders. Like it really, I mean, makes you feel amazing, like right away. You're like, can I please just stay in this thing forever? Well, for me, back surgery was definitely a very last resort. Like, to a large degree, it really wasn't even an option. It would have been the very, very, very last thing I would have considered. I don't even particularly care for pain medications or anything like that. I'm a big believer in treating the underlying issue and the problem and not the symptoms. So this was a logical next step for me. So after I had tried physical therapy, that was getting better, but then it kind of took a big step back, and that's when I started on the DRX9000. At the time that I had the MRI, I thought I was like a level 8 or 9. It was pretty bad. And actually I went through, I don't know if this is typical, but I went through a little bit of an evolution where I started treatments. We were doing it about, I think, 3 or 4 times a week for a couple weeks, and then it went down to 2 or 3. But there was a moment in there where I must have done something to, actually I know what it was. I did a long car ride all the way up to Dallas and back in just a couple of days, and that just inflamed my back so much that that was a level 10 out of 10. It was so bad. But we kept going through the treatments, and I think you prescribed me a steroid to help cut the inflammation back, and that made a big difference. You know, kind of giving it a little 1-2 punch there. But as we have kept going through it, it was steadily getting a little better and a little bit better and a little bit better. I was trying really hard to not have any impact on my spine as I was still teaching my classes through all of this. Definitely modifying, definitely doing a lot more coaching, especially in the beginning for a few months there. But as I was starting to feel better, I was also starting to add in some more weight, starting to add in some more impact, and feeling a lot stronger, and my symptoms were definitely minimizing. So I knew at a certain point that the inflammation was getting under control, and it was actually starting to heal. Now we are stretched. I haven't been stretched regularly, I think for about 3 months now, and I've been feeling really good. Almost everything that I was doing before. Running, not as much, but still running. I do jump squats, I do jump lunges, I lift heavy weights. I'm a big believer in lifting heavy weights. Trying not to put as much load on my spine. So doing lighter weights with a little bit more volume, more repetitions, and still getting a good workout in. Yeah, I really appreciate Texas Spine Clinic and the whole team. They're awesome staff. They, even just today, like haven't been in months, and they know my name, which is always nice, but took really good care of me. They listened to what was important to me and met my goals and objectives, and can't really ask for more than that.